Hi, everyone. Thank you so much for your patience while we dealt with some technical difficulties. Always fun in the virtual setting, but we managed through it, and we are excited to join you today. Thank you, of course, for attending our session and for attending our inaugural World Medical Studies Conference. Today, I have with myself, Anthony, and Claire. Before we let them introduce themselves.
So my name is Anthony. I am the partnership advisor here at AMO. Going to be answering a lot of questions that you guys have in the chat and the questions that everybody asked beforehand. Claire?
Yeah, so my name is Claire. I am one of our rotations advisors here at AMO, and I'm really looking forward to answering your questions today and just kind of going over the basics of AMO and what we can offer.
Thank you both. And I think there was a little delay when I was speaking, so I apologize about that. I also wanted to just introduce myself. I am Advisor Ryan. I do help lead our AMO advisor team. Anthony, Claire, thank you so much for introducing yourselves. And today's session is going to be a little bit different. We are really going to take the time today to speak with Anthony and Claire as their role as AMO advisors. And the goal is to understand why you need a U.S. clinical experience, but more importantly, why you need an AMO clinical experience. So we will be answering questions that have come in advance, common questions from trainees, and as well, questions from yourselves in the chat. So we do recommend ask any questions that you have in the chat, and I will help filter those through to Claire and Anthony. And we hope we can give you a full circle of just some of the knowledge of our AMO advisors, what the AMO advisor role is like and what you can expect, not only when you interact with an AMO advisor, but when you are ready to choose a U.S. clinical experience, how AMO and how our advisor team can help you. So over the next 15, 20 or so minutes, again, we'll go back and forth, kind of just having a natural conversation. And then, of course, we do want to take questions from the chat and from you in the audience. Again, thank you for attending. And I guess we can really just jump right in. Anthony, I'll start with you. Maybe you can just give a brief summary, what is AMO and how does AMO help?
Yeah, sure thing. So AMO Opportunities basically provides clinical rotations to medical students and graduates who, may be applying to the U.S. residency match. You can also use these for applying to your home country, just getting experience as a whole. But the primary goal for a lot of these visitors is for the residency match here in the U.S.
Amazing. And I know how important, the residency match process is, how daunting it can be, how tedious it can be. Claire, maybe you can talk about your role as an AMO advisor and how you help manage trainees and also just anyone with questions, go through that process.
Yeah, absolutely. So our goal as advisors is to assist you to try to find the best rotation that's going to be the best fit for your medical career and the goals that you have. So we do offer over 270 different rotations across our platform, which can be a little bit daunting, but that is our role as advisors to help narrow down those different options for you. So whether you're interested in going to a certain city or state in the United States, or if there's a certain specialty that you're interested in or a subspecialty that really is piquing your interest, then that's our job as advisors to help narrow down those options for you.
Amazing. Really making it much easier to kind of go through, 270 different options. That's a lot. When you talk about the different options we offer, one common question we get, Claire, is, what types of rotations do you offer? We know there's a lot of different terminology that's used, but for AMO exclusively, what types of rotations can one expect to find?
Absolutely. So as far as in-person rotations go, so if you are coming to travel to the U.S., we offer both hands-on and observerships. So hands-on rotations are going to be those direct patient interaction type rotations. You're going to have the opportunity to perform different activities that are not necessarily the practice of medicine. So if you're doing a surgical hands-on rotation, you're not necessarily going to be able to go in and, cut someone's leg. But you can do patient, just different activities that are not necessarily the practice of medicine, whereas an observership is going to be a supervised, more of a shadowing experience. And both of these do hold the same values in terms of a letter of recommendation, which we will likely be going over later.
Definitely. And we will definitely cover that letter of recommendation aspect of it. I know, just how important that is. And you brought up a really important point that I think we always want to get across to, prospective trainees, for those interested, which is, how do hands-on and observership fit into the letter of recommendation? And like you said, there's really no difference. Anthony, maybe you can talk to us about some of the misconceptions on, why one would think, a hands-on is different from observership, and really, why the LOR in the end can be the same.
Yeah, so everybody thinks that hands-on rotations are what really matter. This is what people do to match, and that's really not the case. You can always attend an observership and still see the exact same activities, get the exact same exposure, and the exact same letter of recommendation as a hands-on rotation. They are going to be weighted the same. So if you're planning on applying for the U.S. residency match, they don't all really, have to see hands-on. That's not the requirement. They just want to see U.S. clinical experience. And I briefly touched on some of the activities, and a lot of it is going to be really the same. The only, I would say, minus is just not, physically touching the patients for a lot of those examinations, but you're still going to be doing many of the activities that don't require hands-on, such as taking patient histories and notes, doing case discussions with the doctors and the team, just working in the overall clinic and the hospitals. There's a lot of paperwork involved, which doesn't need patience.
So it really sounds like you keep busy and you really play in experience that you're hoping to get. And if you're trying to learn and you're there to practice your skills, you're going to get that in both settings. Would you say that's right?
Mm-hmm. Yeah, of course. And a lot of U.S. medical students are doing observerships right now. There aren't that many hands-on activities. The pandemic and certain specialties that don't really warrant hands-on activities. So don't feel bad doing observership.
Definitely. And I know we've already exclusively kind of spoke about these in-person rotations, and I'm sure both of you are familiar. Many of us here in the US are familiar with a new exciting way to practice and deliver medicine, which is through telehealth. Here at AMO, we offer virtual rotations, which include access to telehealth and that type of medicine. Claire, Anthony, maybe you can give some insight on what is a virtual rotation and how does that compare to in-person? And whoever wants to take that question.
Yeah, I can start out. So really, a virtual rotation or a telehealth rotation is going to be virtually the same as an in-person rotation. You are still going to have those patient interactions, be able to take patient history, taking notes. You are just going to be doing it virtually. And this is going to be really important even for the match, because telehealth is an extremely large aspect of the US healthcare system now. So this is really going to help you stand out in the match if you do have a virtual rotation, because this is something that is definitely not going to be going away anytime soon. This is a large aspect of the US healthcare. So having this on your resume is definitely going to boost your application.
Yeah, and just to add on to that as well, 93% of doctors nowadays, according to one of our surveys, they operate in telehealth visits pretty much every day. So if you were still on the fence about doing a virtual rotation, it's not really done as much in the US. It's really done every day. So if you didn't have any telehealth or telerotation experience, you're eventually going to have to learn that anyway. And just having that on your CV, having that experience, is going to show those residency directors that look at your application that, oh, they've done pretty much every form of medicine that there is. And that's going to put you ahead of somebody else that has not done that experience.
Definitely. And I think you brought up another really important aspect is, and I know I've personally had many telehealth appointments over the last few years. I imagine the both of you have as well. I'm sure there's still a lot of hesitancy about doing a virtual rotation, a telehealth rotation in kind of a virtual environment. Anthony, how would you advise someone who is hesitant about doing virtual, someone who maybe has been unable to travel the last couple of years with, recent travel situation, difficulty getting a visa, and COVID, how would you recommend that they continue their education during that time?
Yeah, so, with everything going on, the pandemic, we know that traveling is very hard for many of you who are attending and many more. getting a visa, just making sure that you are able to travel. That's why these virtual rotations are a really good fit for, just getting that experience while not just sitting at home doing nothing. It is always better to have some form of experience versus nothing. And, this doesn't just apply to the general practice care specialties like internal medicine, pediatrics. This also affects some of the specialized surgeries, dermatology, neurosurgery, all of that kind of information where you might have to do a visit with a patient that can't go to the clinic, or maybe just have to get a pre or post-op checkup after their surgeries that could just be done virtually. So this is affecting all specialties and all aspects of medicine.
I mean, that really is amazing. And, we've kind of covered the three different types, right? Or the two different types, I should say, in-person, hands-on observership, and then we have the virtual rotations, which comprise telehealth. I think all of those really lead to the same end goal for many trainees who come our way, which is earning that letter of recommendation. Claire, you mentioned earlier how, with the hands-on rotation and with that observership, there's really no difference in the letter of recommendation. And I did even see a question earlier today in an earlier session, are virtual rotations valuable? And I think, from your experience, it is valuable, but how does a virtual rotation play into that letter of recommendation as well?
Yeah, absolutely. So if you do a virtual rotation and you earn a letter of recommendation, these are also going to be virtually the same as a hands-on or observership letter of recommendation that you would earn. We're working with many preceptors, and a lot of them have mentioned that they don't even say that you participated virtually because they do understand that you are still participating in this rotation to your full potential. So that's a really large aspect. I think that's a big misconception that individuals have, that they think that these virtual letters of recommendation do not hold the same value, but they really do. And these preceptors, these physicians are fully aware that telehealth is an important aspect of U.S. healthcare and your education. So these letters of recommendation are going to hold the same value.
Thank you.
And
Anthony.
just to add on to that too, we've had visitors who never set foot in the U.S., who have never attended in person for clinical rotations, and we're able to match into their specialty of choice just by doing virtual rotations. And I think that just really shows how important these virtual rotations are and the letters that you can receive. If they weren't able to match, then maybe that would be something that would, we could say, but if they were able to match pretty easily, and that just kind of shows that these are going to be important, not just now, but 5-10 years down the line.
Yeah, thank you so much. And we actually had a question come in while you both were answering about, a virtual rotation, is it considered, as strongly as an in-person? And I think you both did a great job of, explaining that it is. And I know we had a previous session too, where a past trainee had done 2 virtual rotations and they did match. And again, it's a great way to continue your education. So Chidima, thank you for bringing that question to us. I saw another question come in while we're on the topic of virtual rotations. And this is more so about the cost. Are the virtual rotations more expensive than the in-person ones? And, are there other ways maybe in virtual rotations that you can save money?
Yeah, so I would just say that there's really no difference in terms of the actual cost, but the virtual rotations are going to be considered more cost effective because you don't have to pay for additional things like housing, your flights, food, or extra insurances. You're really just going to be paying for that clinical rotation, and everything else is basically provided by you and where you live.
Amazing. And again, I think we kind of also mentioned the letter of recommendation. And, here at AM Opportunities, every physician, every preceptor, every clinical site that hosts trainings for us, they do offer the ability to earn a letter of recommendation. And I think a lot of times that word earn can scare trainees, right? Oh, I don't get this automatically. Claire, Anthony, can one of you maybe explain, why letters of recommendation need to be earned and not necessarily just given?
Yeah, absolutely. So letters of recommendation are really going to come down to your participation and what you make of the rotation. We like to say that they're earned and not granted because these are going to be personalized letters of recommendation. So we want to make sure that the physician is connecting with you and you're connecting with them and making the most of it. So that's why we say it's earned and not necessarily going to be automatic, because we want you to be able to earn that personalized letter of recommendation and really be able to make the connection with your preceptor.
Definitely.
And
oh yeah, go on, Anthony, please.
Just to add on to that too, these are personalized letters, and they are just going to be based on, what did you actually do during this rotation? If you didn't show up on time, you didn't attend, you didn't ask questions, how are they able to write a great letter of recommendation if you didn't really have anything to show for it? So it really just boils down to participation. Are you engaging with the patients? Are you taking, their histories, their notes? Are you asking great questions? That's just really is what's going to be included in that letter. So just make sure that you take advantage of your full time there.
Definitely. And that's one reason, I love that word, clinical experience. And I think the experience part plays so much into that letter of recommendation. Anthony, you mentioned nice with patients, nice with the doctor, but also everything else that comes with it, right? How you present yourself as you walk in each day, as you speak with the staff, that all plays into that letter of recommendation. And like Claire mentioned, it really does make it personal. I think many trainees want a letter of recommendation to say, I went here, I did hands-on, but really that can just take up a lot of room on that letter. And there's not much room on that letter to talk about you if you kind of use a couple lines for that. So thank you both for kind of diving in on how letters can be personalized, why they should be personalized, and of course, why they are earned. And of course, everyone has the ability to earn that letter. So let's see now. I know we had a couple questions come in, or at least a question come in about the visa process. And I think that's a really important topic to cover. I definitely want to dive in. We are fully aware right now with the current travel conditions, it is difficult to get a visa. It is a long wait time, maybe at the local embassy to even get an appointment. Claire, Anthony, can one of you just maybe talk to us about how AMO helps with that visa process, and what someone can expect when they are asking about the best time to apply for a visa? I know that's a loaded question, but if you both want to just kind of dive in from your own experience, I'm just here to help moderate the questions, but want to hear more from you.
Yeah, I can start off with this. So kind of working backwards, sort of the best time to apply for a rotation. We're going to typically suggest that you apply 4 to 6 months ahead of time. And this is generally going to depend on your visa status. So if you don't have a visa already, we sort of lean towards more that 6-month mark, just because, as Ryan mentioned, we do know that the visa wait times are fairly long for some countries right now. And if you do have a visa, then you can definitely lean more towards that 2-3 month mark. We just want to make sure that you have enough time to be able to upload the documents. And then as far as visa support, so we at AMO can offer you an invitation letter for a B1, B2 visa. So this is a visitor visa or tourist visa. So we are able to offer support for that. Again, we do know that the wait times are fairly long in a lot of countries right now, and we are able to assist with expediting appointments as well.
Mm-hmm. And if it really does come down to, say, visa denials, which can be pretty rare, our letters are really strong, and we have about 90 to 95% of visitors getting accepted on the first try. But if you are that 5% that don't get approved, we do have options for you. You're not going to be left alone with no support or anything at all. Number one, you can try reapplying again. We're going to make sure that the doctors at the hospital can provide some supporting documents to increase your chances of reapplying. You can apply for a virtual rotation. That's probably one of the most popular options that we offer, because you still get some form of clinical rotation right away. You don't have to apply for a visa. You don't need to work on getting housing or anything like that. The third option, least popular option, is if you just deny, you don't want to do anything or reapply, you can ask for a half cash refund of your payment. But this is not an option that we recommend, because you're losing out on the clinical experience that you could have gotten, and it's just a waste of money and time. So try reapplying. We will help you. We're going to have a dedicated team of coaches that will assist you, and we're going to get into the coaches later. But Typically, we'll just help you with reapplying and then also switching to a virtual if that is an option that you're open to.
And Anthony, thank you so much for, kind of discussing what happens if, you are denied the visa and kind of the options that you have after that. And we did have a question come in from someone who was refused a visa, and they're wondering how they can boost their chances of obtaining that visa. I think you covered some of those, points, but I think the most important point is AMO is here to help you with that. We have had trainees who, in the past have been denied a visa and have reapplied again with an AMO support letter, maybe additional documents if they're needed, depending on your denial, and we're able to get approved. I know, I've been familiar with another trainee who was denied twice and on the third attempt was able to get approved. And I think what's comforting to know is your advisors, your coaches, we are here to help you. We understand that ultimate goal is getting that clinical experience. And if you want to do that in-person rotation, we're going to do everything we can to make sure that you can attend, in a manner that fits the timeline to get that visa. And as Anthony said, in the end, we always will have an alternative with the virtual rotation that's going to be just as valuable. And I think this is probably on me. I forgot to mention what type of visa we offered. We support, I should say. But, Anthony, what kind of visa can someone join under specifically?
Yeah. So Claire actually did answer that question, but it is going to be that B1, B2 visa. It's in the same category. And if you just wanted to be less technical, it's a tourist visitor visa.
All right. And thank you, Anthony. I'm sorry, Claire, I missed that. Perfect. And I had another good question come in. I'm glad we're getting some engagement from the audience. Please continue to ask as many questions as you have. We will try to filter them through. For Anthony or Claire, how many rotations do I need to do before applying for the match?
Yeah, that's a great question. So for the match, you want to have as much experience as possible to really enhance your CV, but you'll need 3 letters of recommendation to apply for the match. So that would be 3 rotations. So you can obviously do more, but you can't do less necessarily. So you're going to want 3 letters of recommendation to apply for the match.
Mm-hmm. And just to add on to that, I did see Chidinma asked an additional part of that is how long are these LORs valid for? They're usually going to be valid for 2 years. So if you are applying for the residency match, they want to see these letters written within 2 years of applying. Now, you can use LORs that are older than that 2 years. You just have to get them rewritten from that original preceptor that you had, and they can be used for that upcoming match or whenever you are planning on a matching in 2024, 2025, how long it is.
And Anthony, maybe you can talk about that more, right? You rotated 3 years ago, 4 years ago, and you need that letter. What if you can't contact the doctor? What happens?
Sure. So if you rotate with us and, it's been a few years and you can't get in touch with the doctor, maybe you lost their email, you can always reach out to us and we will connect you with your coach and they'll be able to reach out to you and just let them know exactly the doctor's contact information, just so that it's easier for you to reach out to them. If you are still having trouble, we can always reach out to them directly just to make sure that you are back in contact with them.
Perfect. And I think Chidinma, thank you so much for joining. It sounds like you did a rotation with us in the past. But again, I think your preceptor definitely, probably gave you some advice with that letter. But, if you are planning to apply to a later match, we can always help you get back in touch with that preceptor, get an updated letter of recommendation. That's something we always want to be here to help with. So definitely reach out to your coach. You can reach out to anyone at AMO. We'll direct you to the correct individual, and we can definitely help with that. Let's see. I thought I saw another question come in. Anthony, I think this question was for you. I don't know if this was necessarily about the visa or maybe AMO documents, but Anthony, will initial application and uploaded documents be restored for the ones who decide to reapply? If that is regarding the visa, I'm not too sure we are positive about that. So I don't want to give any wrong information, but Anthony, do you know if you have an answer for that, or maybe we can direct them to someone else after the presentation?
Yeah, so I actually remember Sabahat. I was working with her not too long ago from Tajikistan. Remember that. But if it's about your AMO application, usually all of your documents are going to just stay there, and you can continue using them in the future. If it's for the visa application, I'm pretty sure they usually have your information on file. But when you do submit in another application, I do believe you have to re-enter all the same information. But a lot of that information is going to just be background information. Who are you? Where are you from? Your address, personal information. Maybe some information on what city you're going to for a rotation, and that's really it. The visa application does seem a little bit intimidating, but a lot of the questions are just going to be personal to your private information.
Definitely. Thank you. And it does look like, thank you, Sabahat, for clarifying. It was regarding AMO. So thank you, Anthony, for covering that. It's almost like all the documents pretty much work except any ones that maybe need to be updated, like immunizations, if you fall with outside any guidelines, and maybe health insurance or malpractice insurance just for the updated dates. But typically, we will store those documents on our site where you upload them, and we always encourage you to upload updated documents. We know many of you are doing multiple rotations, and you're excited to add that to your resume. You can always upload a new resume to the AMO site, and that will be the resume CV that gets sent over to the preceptor when you reserve. So you can definitely do that as well. A couple questions came in, which I think will be great to answer. So when you get a rotation, how do you meet your fellow, medical students, AMO rotators with the same rotation and at the same clinical site? Claire, Anthony, maybe you can talk about the coaches and the virtual orientation that they host, and then maybe for those that are rotating, whether in person or virtually, how they interact with other rotators.
Yeah. So as Ryan mentioned, when you reserve a rotation, you're going to be assigned a coach. And so your coach is going to be the person that's going to help guide you through the enrollment process. So this would be, uploading any remaining documents, assisting with finding accommodation, all the things that you need to do to prepare for your rotation. So they do host a virtual orientation for you. It's usually, I think, about a month or a couple weeks before your rotation begins. And so that will give you a chance to sort of connect with those that are also participating at the same time as you, or even in the same city that you are, because we do have, multiple rotations in cities. So your coaches are going to be the ones that are going to help you through that process, help you connect with other individuals that are participating in a rotation.
And, you don't have to always hang out with them just during the rotation itself. There are many, previous attendees that have become lifelong friends, and they're still talking to each other now. You can, outside of the clinic or the hospital, you can always just have fun, go out to restaurants, tourist sites, and just enjoy the city that you're in for the first time.
Yeah, thank you, Anthony. I think that's another just kind of one of those between the line benefits that you receive is interacting, making lifelong friends with colleagues, friends, those who have the same goal as you. I know I had the opportunity to meet over 20 different rotators in New York a few years ago. And in Chicago for in-person rotations, we would sometimes invite rotators, trainees into our, into the office to play games, maybe go out to dinner. So we definitely understand that social aspect as well. And we want you to meet other trainees, other rotators. So thank you for covering that. Now, another question, Claire, how long is the average rotation with AMO?
Yeah, that's a great question. So all of our, not all, but majority of our rotations are going to be 4 weeks long. They do typically start the first Monday of each month and then go for 4 weeks after that. I think this is a great point right now to bring up. If you do have any sort of schedule requests, maybe those dates don't work for you, you can always work with us as advisors to sort of adjust those dates and make requests for you. So if you're looking at a rotation and you do have any sort of special requests, please don't hesitate to ask us as advisors how we can assist with that, because our entire goal is to make these rotations as accessible as possible for you.
Thank you. And another great question that came in, great time to speak about this, but I know we've been talking a lot about rotations for medical students, for medical graduates. We had some questions come in. Do we offer rotations for physical therapy students, for dentistry students? I know in the US, the schools are usually separated out, but globally, many of those programs take place at, in a medical university that teaches also dentistry, physical therapy. Anthony, can you talk about the dentistry and physical therapy rotations that we offer?
Yeah, so we do have over 70 different specialties, and that does include dentistry and physical therapy rotations. If you haven't made your AMO account yet, it's going to ask you in your profile, what type of student are you? Are you a dentistry, physical therapist, even a nurse, um, or a medical student or a graduate? And that's going to show you, which programs you can directly apply for based on your profile. So we do have a lot of great options for physical therapists, for dentists. If you had any questions about those, you can always reach out to us, and we could always recommend you what is going to be the right program for you.
Definitely, thank you. And that is one of our core values. That is one of our missions to, provide these opportunities. If you are ready and willing to learn, we always want to utilize our network of U.S. healthcare preceptors, clinical sites to provide you that opportunity. So, don't never hesitate to reach out to an advisor. If you are interested in a specialty, and maybe you don't see it, or you're interested in, learning more about one specific field, and you're interested to know if there's one specific topic a doctor may cover. That's what our advisor team is here for. I think Anthony, Claire, you've done an amazing job just showing the full range of knowledge that you have, not only about U.S. clinical experiences, but the hurdles and the process that IMGs have to go through to get these experiences. Our goal is to make it easier to, allow you to search on our website and see, oh, these are the options available. One thing we haven't discussed much about is the cost. And I think there's a good reason for that, right? It's free to speak with us. It's free to use us as a resource. It's free to apply to a clinical experience. We want to make this easier. Yes, there is a cost, if you do reserve a rotation, but we know that that's the last step. Before that, we want to make sure you're getting the right rotation, for your end goal. Everyone learns differently, but everyone ultimately has the same goal in mind, right? To benefit your education, to enhance your application for residency, or to enhance your CV. So AMO is going to be here. Our advisor team is going to be here to help you with that. We want to be a resource. We want to answer your questions. And we're just so happy to see, tons of questions coming in today. We love the engagement, and we want to make it easier for you. We actually do have a follow-up presentation next week on the 23rd. I believe it's at 6 p.m. Central Time. We're going to send out more information, but it'll be a little bit more of a formal presentation where we can run through the website, answer more questions. But I just wanted to take, a couple minutes just to mention that. We will send out more information again, but we hope to see you there. And I know we have some more questions coming in, so I'll go ahead and get back to those. So it looks like we have a great question from Calvin. Should I ask for LOR to be uploaded directly to ERAS once I get ready to apply for residency, or should I ask to give it to me directly so I can upload it myself? Anthony or Claire, maybe you can talk about getting your LOR delivered and the options you have, and maybe some of the benefits of each.
Yeah, so honestly, you can do either or. Personally, I would ask the doctor to upload it directly to the ARIS application, just because it is easier and it does kind of waive your right to see that LOR, which makes it a little bit more weighted versus, being able to see it and make changes. So that's what I would recommend. All of the preceptors know how the system works. So, you just have to ask them, hey, can you upload it directly to the ARIS system? And they're going to ask you for that special link or that code that they use to enter it directly to your application.
Yeah, and Anthony, thank you for mentioning that. You brought up a really important point that sometimes I don't think gets discussed enough, which is the preceptors who work with AMO, not only are they willing to write letters of recommendation, they understand the process and what happens next for the ERAS. We understand you can get rotations elsewhere, but that might not always be the best learning environment. The preceptor may not know, how to upload any letter of recommendation, have an account, etc. With AMO, we vet our preceptors during the onboarding process so that, there's never any trouble with that process with the letters of recommendation. And that's another benefit of working with us. The preceptors are ready to teach. They want to provide a learning opportunity, and they can cater a learning environment to many different years of medical students, graduates, as well as dentists and physical therapists. So another question came in. how many rotations are needed to be done for a successful match? I know, Claire, you had mentioned, 3 letters of recommendation is the minimum. You want to have 3 letters of recommendation from U.S. preceptors. But, would you say, there's like a successful match would have more, would have less? I don't necessarily think so. I think letters of recommendation are always going to be one of the most important components of your residency application. But it's just because you did 7 or more doesn't necessarily mean you're going to get matched. It's the application as a whole. So something I just wanted to mention as well. I don't know if either of you had any experience maybe with that type of question, or maybe your experience interacting with trainees on how you've helped them navigate. But I just wanted to give you the opportunity to see if you did have any experience with that.
I would say you answered that perfectly, Ryan. Like you said, just doing a large amount of rotations, so doing 10 rotations doesn't necessarily mean you're going to have that successful match. As we discussed earlier, you want to earn a strong letter of recommendation, that personalized letter that really shows your skills and your ability as a medical professional. So again, it's that minimum of 3. I'm not saying you should only do 3, but doing 10 or 12 is not necessarily going to guarantee a match. You do want to focus on those letters of recommendation and, really enhancing your CV.
Yeah, and there are a lot of factors that really do play into, how to match successfully. There is no right or wrong. If there was, it would be easy and everybody would be able to match, but that's just not the case. It really just boils down to, having really good grades in medical school, passing the step 1 on the first try, getting a really high step 2 CK score on the first try, getting, as much experience and, just trying to get those really good letters of recommendation are a really good start to it. Some of the other factors that a lot of people don't think about are, my ability to speak to people. If you can't really speak to patients, you're going to have a really hard time matching, because that just really shows that you aren't really a people person. And if you aren't able to connect with your patients, it's going to be really hard to do that.
Yeah. And I think your clinical experience is a great way to practice those skills. And I think that goes back just to the original question, it's how many rotations is right for you to feel comfortable and confident, on your USMLE step 1, step 2, and your application. So I know we are winding down on the session time here. There was a question that came in about constant communication with your preceptor after a rotation. I think it's always good to keep in touch with the preceptor. I think the word constant could be a lot, but I would say definitely checking in occasionally, maybe once or twice a year. Doctors are busy. You don't want to burn that or hurt the relationship by over communicating. So always best, hey, when is available? Maybe we can check in once or twice a year. I'm sure that's going to be more than fine. And again, the preceptors are here to help you, and they are here to help you match. We understand how important, our preceptors understand how important international medical students and graduates are to the U.S. healthcare system. I think it's about 28% of our healthcare providers are IMGs. So the doctors that we work with, the states, they want to play into that goal, and they want you to match. Again, I know we're running down on time. There's one question I definitely wanted to cover, because I do imagine we have many medical students here. Anthony, do we offer core or electives for any students looking to do university credit? Maybe you can talk about that for a minute or so.
Yeah, so the simple answer is yes, we do. If you were looking to get any cores or elective credit, done for your university, we can always look into see which programs would be able to meet those requirements. We will, always recommend scheduling a call, making sure that you have spoken to your school, that you are fully aware of, what are the requirements, what documents do I may need to get signed by the preceptor, and reach out to your AMO advisor, and we'll be able to discuss with you which programs would meet that, and discuss what is the elective and core process that we have to go through, because our main concern is to make sure that we meet these requirements and that you get that credit. The last thing we want to happen is that you'll attend a rotation you reserve, and then we find out that the rotation you applied for isn't going to meet that qualifications. So we like to offer that guarantee by making sure that you go through the special requests that we make, just to guarantee that that is going to work for you.
Thank you so much for answering that, Anthony. I know that's probably a really important question for many of those of you in attendance. And, we always want to encourage you, speak with an AMO advisor. We really are here for you.